So, sooner or later, it's going to snow and we're going to have ice. And you are going to be worried about how you are going to walk on snow and ice without falling on your butt. Well, I'm going to teach you how to do that today the right way. And I want you to stay to the end because I'm going to explain what this big red dot on my belly is. It's not a piece of jewelry. It's not body jewelry. It's to help you understand a really important concept about how you should be walking. So, in any situation where there's snow or ice, you want to think about your center of gravity and your base of support. You want to walk like a penguin. Now, how does a penguin walk? A penguin walks like this, more or less. A nice wide base of support, and they shift their weight from one leg to the other. So let's talk a little bit more about that. What is my base of support? My base of support is basically the area underneath where I am standing. So here's a wide base of support. Here is a narrow base of support. So the wider your base of support, the more stable you're going to be. You want to keep your center of gravity inside your base of support. Now, what's my center of gravity? Well, for most of us, your center of gravity is about 2 inches inside, on the inside of your belly button. So, hence the red dot. The red dot shows you where your center of gravity is. Now, it makes sense that if I have a wide base, my center of gravity is well within that base of support, I'm going to be nice and stable. Conversely, if I stand on one leg, super narrow base of support, right? And my center of gravity, it's easy to go on either side of it, then I'm in trouble. So when you're walking on snow and ice, I want you to, number one, make sure that your center of gravity is within your base of support. That means you want a wide base of support. Number two, you want to try to lower that center of gravity as much as you can. So if you get in a kind of a crouched position, you're going to lower that base of support, that center of gravity, and that is going to get you an increased degree of balance and safety. Now, are you going to look funny walking around like this? Yes, you are, but it's better than falling and breaking a hip. So let's now talk about your stride, or how you take a step. Now, if you take a long stride, right, there is a tendency, and I'll use this piece of equipment to show you, to have a really big angle like this. It's not very vertical, is it? So if I take a long stride, I'm going to have a tendency to go forward and slide out. Versus if I have a short stride, my lower leg is going to be relatively vertical. And that's a good way to walk, right? So try to keep your lower legs as vertical as possible. So stride length is important, and stride width is important. So keep your stride short, keep your stride wide, lower your base of support, your center of gravity, and that's going to keep you stable. Now, what happens if all heck breaks loose? Your center of gravity gets outside of your base of support and you fall. How do I want you to fall? Now, what I want you to do is I want you to think like a ball. I want you to tuck, and I want you to bend your chin forward, and I want you to flex your back forward. I want you to keep your knees bent. I want you to try to get like a ball. Get like a ball and roll. Now, I understand when you fall, it happens fast, but it also happens slow. If you've ever fallen, you've probably said to yourself, I can't believe I'm falling. I'm falling right now. So things do happen somewhat slowly. You do have time to react to it. I want you to get up in a ball no matter what direction you're going in, and that's going to keep things from breaking. So that is my goal for you. If you fall, I don't want you to break anything. So try to fall like a ball. And that's about all. Thanks for watching.